What's up, guys? Welcome to another episode of the Kiss Capids podcast. And today I have a very lovely guest with me today. Let me just let her introduce herself and what she does, and then I'll just, you know the drill. So introduce yourself and tell the people what you have going on.
Hi guys, my name is Ijaba Ahmed. I am currently training at Kenyatta National Hospital. I take pictures on the side, and
Training to be because there are people who don't know what Kenyatta.
I am currently training at Kenyatta National Hospital to become a doctor, and I take pictures on the side as well. And I recently launched a medical relief fund. So yeah.
Wow. That's a lot of serious stuff going on there.
Yeah, I try. I have a lot of jokes on the side as well, but we leave that for later.
Okay. I've just been told, I don't know if this applies to you. We have... What?
I'm not a fan of coconut.
Okay. Yeah, she's good.
Thank you.
Yeah, she's not a fan of coconut. Okay,
Yeah.
That was just an option. So we're going to talk about a little bit of, just from my standpoint, like with just curiosity and everything. Like even like you notice like what my favorite like waiter just said.
Yes.
Like he said like he's never been treated with like a Muslim
By Muslim doctors, true.
before.
Yeah.
And even me too. I've never like I've never come across any
Muslim doctors.
Yeah, but apparently in Kenyatta Hospital, you've said...
Yeah, I feel like we're actually a lot. Like the students,
But I think
faculty.
there's students, faculty.
Yeah, Muslim doctors, Muslim students, Muslim nurses as well.
Yeah.
Yeah, they're around.
But I think the pattern has been recent, probably in the last 5 years. Before that, I don't think the number was quite...
Yeah.
Was it?
Maybe not as much, because growing up, I actually had a non-Muslim doctor. Like I hadn't seen a Muslim doctor as well, growing up here.
Oh,
in Kenya.
yeah.
Yeah. So I had a Kenyan doctor, the nurses were Kenyan when I was growing up. The doctors were Kenyan. There were very few Muslim doctors at the time, but now I feel like we're a lot.
Like pilots, doctors, and engineers, quite a lot.
Yes, recently I feel like we're coming up.
And women especially, that's something also that I'm guessing like people are not used to.
Yes, actually. Okay, we have people who we have this mentality that...
Oh yes.
Preach. Yeah. Basically, okay, people feel like when they see a lady in a scarf, or rather just a lady, it's like, are you really a doctor?
Yeah.
Are you really a doctor? You know
A
what I mean?
doctor? Are you sure?
Yeah. And then I've had this personally done to me. Like you'll be in the hospital,
Yeah.
and then a patient or a patient's relative will come up to you and be like, "Hey, nurse," and I'm like, "Do you assume?"
Immediately.
Like there's nothing like, "Oh, hi, are you a doctor?" or "Hi, are you a nurse?" Nothing. Like they just assume
Immediately.
That, I don't know if it's because I'm a Muslim or if it's because I'm a lady. They assume that you can't really be a doctor.
Yeah.
So
I'm afraid of being treated with women doctors. I
feel like we're so nice and like gentle.
They are, and that's where the scariest bit is like, I mean, she's too nice. Maybe she's too nice because she doesn't know what she's doing.
Oh, no.
No, but I'm playing. I don't want people to start attacking me like, no,
guys,
I'm just saying.
What you've said.
I'll tell you why. Oh. Maybe it's because I don't want to feel weak as a man.
Yeah,
I think that's where it comes in.
Okay, but my question is, what exactly about her being a professional is making you weak? Like, isn't that a problem with you rather than...
It's me, and I know, but, you live and learn, because I'm learning all these different things every single day. And this is me. I'm very like, I'm one of those people who are like, into women's movement, women independence and everything. How about people who are coming from...
Are you a feminist though?
I'm not a feminist.
guys.
Let's not go. Let's not push it. We'll talk about that if you want to.
Okay.
So, like, just tell me a bit of like your background. Like, what, did you grow up trying to be or dreaming of being a doctor, or where did that dream kick in?
Oh, that's a good question.
Yeah. What did you want to be, like, just as a baby?
In my household, rather the African households in general, parents don't really believe in or rather parents back in the day, or rather a few years ago, they never really believed in, I'm going to become like a chef, or I'm going to become like a photographer, or I'm going to become like basically anything that's not like the ideal like professional jobs. You know what I mean?
Yeah.
So, so for me, basically, I did want to become a doctor all my life till a certain point where
you did?
Basically, yeah.
Oh, okay.
Like in my head, I was like, okay, I'm going to become a doctor. I'm going to wear like the white coat. It was all about that.
Yeah.
But then towards the end of high school, I was in love with physics, right?
Oh, wow.
And I was considering becoming like an engineer. Okay, but the thing is, ideally, that's like a man's job. You know what I mean?
Yeah, like, I don't know what you mean. I don't know what you mean. I believe in women can do anything they want to be.
Okay. Basically, I was really in love with physics, and I was considering maybe becoming like an engineer.
Yeah.
Because I was like, I like chem, I like math, I like physics. It's like I was meant to become like an engineer.
Yeah.
But I low-key also want to become a doctor. So I was like, Then towards the end of like year 11, I decided, okay, what if I do like medical engineering? And I combined two fields together and do medical engineering.
I don't even know what that is, but
medical engineering.
What's that?
Medical engineering is basically engineering in medicine. Like you make like CT scans, or you design like MRIs.
Okay. Now we're getting warmer because I watch that on TV and series all the time. Yeah. So I mean, it's not far-fetched from what I know. Okay, Okay. So you grew up and you thought that you could combine the two.
Yeah,
and then
I was like, I like medicine and I like physics. Why not like combine the two and become like a medical engineer? But the thing is, not a lot of schools were offering that course because it wasn't really as common as medicine itself or as engineering by itself. Yeah. So then, and the places that were offering were really expensive, like expensive enough to like drill a hole in your pocket or
where
did
you
pocket.
Where did you study first?
I studied in China.
Jeez. you see that's the most interesting thing about it, because like even when I talk to my guests like on Instagram, I just try and like from how I interview people, I just look at their pictures. So at least if you post a few pictures, I'd be like, I'd be interested in a bit of idea of what they're about, because I don't want to come here and just talk like medicine. I just want we can talk about medicine, but everything else that's like influenced like your lifestyle and how you studied, background and all those things. So studying medicine in China. Yeah. Speak Chinese?
Low-key, here and there. Like not fluent, but I get around.
Okay, so you left. Okay, how did you get to go to like just China and study medicine? Because you're saying in Kenya. Did you grow up in Kenya?
For
partly.
Partly.
Okay.
Okay, so basically,
I'll let you tell the story.
Okay, sure.
Yeah.
Sure. So basically, I finished high school, and my brother at the time, my older brother, was already in China. He was doing engineering in China as well. So when I finished, I wanted to become a doctor. Yeah. And the university in Kenya, first of all, they're known for striking. Yeah. Right? Yeah. The lecturers strike, the doctors strike, the nurses strike. So then that puts like a hold on the medical students. And that's not fair for them because they didn't ask for strikes.
Yeah. That's not what you signed up for.
So when I went to school, basically, and like was looking into like maybe going to like University of Nairobi for medicine, apparently they charge foreigners like more than double what they charge the local students. And that's not fair because I don't have that kind of money to pay double, you know what I mean?
Yeah, but it's Kenya. I mean, come on.
Yeah, but like I'm trying to be a doctor to help you and help Kenyans.
Oh, yeah. Okay, yeah. But there should be like a policy where like if you're going to practice like in Kenya,
we give you like a discount.
Yeah, like
exactly.
I'm sure even some countries have like certain policies that are close to that.
I'm sure they do. So they were like, oh, we're going to charge you like 1.something million shillings. And that's like a lot of money. Yeah. Because like the local students pay slightly less than $500,000.
Half?
Slightly less, so like 400.
Like 400?
Yeah, 475, 480.
For how long?
For a year.
For a year?
Yeah.
Okay, so that's
and then
that's $4,000.
Roughly, or 4,750.
Okay.
Yeah. So, and then you as a foreign student who's getting the exact same treatment, the exact same strikes, the exact same everything, you're paying like 1.something million. Is that fair though?
No, you'd rather just, if you have an option of going somewhere overseas,
cheaper, go somewhere cheaper.
And you can still come and practice it here, why not?
Exactly.
Why not?
Exactly. So I was like, you know what? Nobody has that kind of money. Let me like look to like other options. So then I realized that China was actually affordable, and it was good, and it was a 6-year course.
Wow.
Yeah. So I was like, okay, sure. Let me go China.
Yeah.
Try something new, see something new. Yeah.
How long is the normal course like in Kenya?
In Kenya, it's 6 years, but then when you include like the strikes and stuff,
you can actually do like 10. If I'm not
10, but like 7, 8.
No, but 8 is close to 10. Cause here's the thing, I'm guessing after you finish that, there's the whole thing of, is it training? You're sent into internship. You're sent to all these different places. Wouldn't it become close to?
It would, yeah. And then like 4 years if you want to like specialize. So before you know it, you're like 50.
Listen, no, but here's the thing. No, but we'll get to that because I was asking one of my friends like, yo, by the time like you're done with like the whole process and everything, and then you just start getting like that and equal that good amount doctor money.
Yeah.
Like, are you still young enough to actually enjoy that money, or now like you have that cash, it's now for your family and everybody else?
That's true. Yeah. So the thing is, in Kenya, first of all, people enter medicine for different reasons, if I'm being honest. The people who enter medicine for the money, the people who enter medicine for the satisfaction of like treating people, you know what I mean? And like kids and women.
Like you're actually passionate about,
So if you're in it for the money, then the public sector is definitely 1,000% not for you.
Not
because
for
the
you?
Public sector is not like you don't go to Kenyatta for money because you're not going to get money. If you're working at Kenyatta, I don't think that the money is that well for you to be like, oh my god, like I'm like throwing money around, I'm like rich.
And how much work will you be doing?
Oh, you'll be doing a lot.
But experience, you'll definitely...
Yes. So if you're in it for like the passion and like the experience, then definitely public sector is definitely for you. You will learn, you will see different cases. Especially Kenyatta, there's like a lot of like referred cases. So you'll see a lot of like different cases with patients. So if you're in it for experience and learning and just like the passion of treating people, go to the public sector. If you're in it for the money, public sector is 1,000% not for you. So,
we'll
open like a clinic or something and make private money.
But that costs a lot of money as well. I think I've had friends who've tried to. They've opened them. But before we go to that, let's just take a step back and tell me just how the process was like, just learning this in China. Cause I'm guessing were you traveling a lot as a kid?
Yes, actually.
Oh, you were?
Yes, I was.
Oh shit, that throws me off with a lot of my questions. But I always have like a plan B.
No, we'll spin them around.
Okay, so where in which country did you like spend like most of your childhood?
Kenya, actually.
Kenya?
Yeah.
Okay, so then my questions is relevant. Yeah. Okay, so here's the thing. You're used to a certain race of people.
Yes.
How they talk and everything.
Yes.
How do you just adapt to that new environment? Plus this is medicine.
Yeah.
Like, do they study in English or?
Yes, they offer both. They offer Chinese and English. So then you choose the one you want.
Okay. So for foreign students you can still.
Yes.
But how was the experience? Because you're already used to Kenyans with striking and like all the things that come with like just the Kenyan environment. Mentally you're ready for that.
True,
how was it just studying and doing all this in China?
Okay, so first when I went to China, everything was different in terms of like development. Like they were really developed. Like the roads were good, the buildings were good, transport was A1.
Oh yeah.
Yeah, so that was different. But the one thing that I honestly did not like was the fact that they're not really used to black people, let alone black people.
Can you blame
with, like
them?
Scarves. That was like, that was like, yo.
Yeah.
So basically, they really do stare at you in public places.
They do how they touch like your skin. I've been
touch.
told that.
Yeah, they touch and
they touch before even asking.
Yes, they do 100%.
Be like kids do that thing where they
the kids even start crying when they see you. They're like, oh my god, what is this?
What?
Yeah, I've had kids cry when they see us black people.
Oh wow, they should see me. Well, I wonder how their reaction when they see me.
Yeah, and you know how African ladies, they have like their braids, like the extensions.
Yeah.
So we'll be on the bus with my friends, and then all of a sudden someone is touching her hair. Like, wow, what is this?
Yeah.
Like she's touching your hair with nobody.
Yeah, I hear the curiosity is so insane that they actually come and just touch and they're like wowed with even if it's skin, they just want to see if it's rubbing off. Yeah,
some of them have this mentality that if you're like of color, you're like dirty.
Yeah.
Like you got like this because of dirt. Like you don't scrub enough in the shower.
So if you take a proper shower.
I've had stories where people have gone swimming and the Chinese people get out of the swimming pool. Because they're like, Like, this is like dirt. Like,
no, but you also have to understand. And at times, you see, here's the thing. This person is actually not being directly offensive. It's they don't know.
Exactly.
They don't understand this.
Exactly.
Like, they're not like the only thing they know is their culture. And I hear they're super, super rich in their culture.
Yeah.
So you wouldn't blame them.
There was actually a friend of mine from here who asked, like, oh, like, how are you surviving in China? Aren't you like, fed up and offended all the time? And I'm like, listen, assuming us now in Kenya, like me and you now, okay, we're sitting here. Over there's like a guy who has like red skin. Wouldn't you be stunned, like, yo, what is this?
We have to call security.
Yeah, like, why is his skin red? That's exactly how it is for them.
But yeah,
they
I
don't see black people. The TV, like, they have no black.
Their channels, their movies, their music.
So imagine a kid who has come from like the rural areas, who has seen nothing but Chinese people.
It's hard.
Chinese people.
Yeah.
Then he's on the bus and he's seeing you in your black abaya, your black scarf, you're black, your skin is black. He's like, hey, what is this? And then he starts crying because he's never seen this before. This is like the monster. This is like the monster who lives under the bed. Like, why are you black? You know what I mean?
Yeah.
So
but
after,
did that get to you?
At first, yeah, it did. Like, it was really pissing me off. Like, why are you shocked that I'm like a person of color? Or why are you stunned that I'm wearing like a black abaya or like a black scarf? Like, you know. But then after like a few years or like a few months, you realize that it's really not their fault.
It's not.
They really are closed.
They
mentally.
don't know. They don't know.
They really don't know. It's true. Yeah. So at some point it does piss you off, but then you just get used to it, honestly.
Once
like
you start
on the bus, oh god, on the bus, you're on the bus and it's crowded and they're like Chinese people, and then literally, okay, like everyone like starts holding their nose. They feel like your perfume is like disturbing them. Does that make sense?
How? Do they put on
no things? Okay, they don't really use perfume.
Oh, they
sense.
don't?
Yeah.
Oh, they don't?
No.
Why?
I don't know. Like, they're like natural, you know.
Oh, they like the natural.
Yeah.
Oh, wow.
So if I'm on the bus and I have like my perfume going on and I'm like I'm smelling good.
Oh, it's
for them. It's like, no, like you can't be.
I can
like
just imagine the perfume, the way you look.
Yeah.
The scarf. They're like, oh my,
like, no,
why? What is this? What's going on?
Yeah. And then there are those people who are really, really nice. Like, they come up to you and they're like, hi, where are you from?
Oh, they
like,
want to know. They really want to know about you.
Like, they're not really offensive, if that makes sense.
It's curiosity. Yes. It's just curiosity.
So they want to inquire more, like, where are you from? So some of them are good, some of them are offensive, but it's really not their fault.
Okay. But how come, now about, let's talk about the studying bit. Like, how is it, like, just taking the classes, and was it much easier? Did you do practicals?
Yes, we did.
So practicals means you have to engage like with Chinese patients, I'm guessing?
At some point, yes.
Yeah. So now I just want to know how that was like for you. Were you afraid of, like,
yes,
like giving somebody like bad treatment and be deported? Like, like what was going on in your head, and how was it like just, having that experience?
So at first, for the first 3 years, we didn't really do like hospital practicals. We did like practicals like on dogs.
Oh wow. Okay, now you see why. You see now why I'm afraid. I was right. Huh?
No.
So I should be afraid of you treating me.
No, but the thing is, at first you can't.
Is that how they do it? Use
like dead bodies and animals. I'm so sorry, guys, but this.
No. But that's okay. Here's the thing.
But we don't kill them though. We just treat them and then let them go. Like, we operate on dogs. But we don't kill the dogs.
Here's the thing. I'll just let it out there because we used to go with. We'll go back to your story, right? So I have like this doctor friend, and at times he used to go for seminars and stuff. And I was like, yo, bro, but this is back when I was like, I think in college, I guess, or back just starting off before I started like my internship in advertising and everything. So it was like, I have this seminar, there's a lot of food, you can, just come. Because basically I was going there for the food. There's no other reason. I wasn't going there for networking or anything.
Why else do you go for it?
Yeah. So like the friends would be like, yo, like meet the friends and everything. So I was like, yo, so what will I say that I do? So told me like, do this when we're there. You just say you're a vet.
Wow.
So like every time like, yo, this is my friend John. They're looking at my hair and then they're like, this is a doctor?
Yeah.
I'm like, I'm a vet. And they're like, oh, that's interesting. That's interesting. Okay. But they don't have any questions for me. So I'm like, safe for there.
Yeah.
But so just something that, reminded me of when you said, treating animals and everything. Yeah. But is that like the normal procedure they use there to, or is it like normal everywhere? Do they do that in Kenya?
In Kenya, I know that they use dead bodies. I don't know about the animals though.
Yeah.
But in China, we only use like stray animals. So we get like a stray dog. Maybe he needs like an operation. Okay, so they bring him to us. We give him anesthesia, guys. We don't just like cut into the dogs. We give him anesthesia, and then we do the procedure, and then we just stitch him up. Yeah.
Okay, next question.
Yeah.
I mean, were you ready for just dealing with, like dead bodies,
no, I was
animals
not.
And everything?
No.
Yeah, because I heard that a lot of, even students, some quit from that point.
Yes.
They're like, okay, I thought I want to be a doctor, but this is not for me.
For sure.
Yeah, so dealing with the blood, dealing with, just people in pain and suffering and all those. Like, how was that for you? How did you adapt to? Because you either have to be a psycho, either you're doing drugs, or because the normal people now, I respect, because even that's why, even I hear older doctors either smoke a lot, drink a lot, and all those things. But how did you
cope with it rather?
Because you seem like a very jovial person.
Oh, I am.
Yeah.
Okay, so basically, at first, I don't really mind blood as much, but I mind vomit. I can't stand vomit.
Yeah.
Like if you vomit, I'm vomiting with you. Like we're vomiting together. I can't stand the look or the smell of vomit. That's not for me.
Yeah.
But blood was fine. The dead body was kind of shocking, if I'm being honest.
Yeah.
Because it smelled funny. Like our eyes were watering because of the chemicals they used to preserve the dead body.
Yeah.
So it's like your nose is running, your eyes are running. It's a very uncomfortable situation, but you're there to learn. Right? So at first it's very disturbing, to be honest. But then you do the thing for 6 weeks. So after some point you're like, you know what, this guy's dead. I can't kill him, can I? So
yeah. So but you get used to it?
Yeah, you do. You get used to the dead bodies.
But what was the initial the one thing that maybe that really scared you, maybe cutting and something spills
I was no. The first time we had the dead body, I think I was end of first year or beginning of second year. I was like, no, you know what, guys, you guys do this, me, I'm out.
You had second doubts.
Yeah, because then you learn the layers of the skin or the layers of the body rather.
I don't know them.
You peel the skin off the dead,
like
dead
an
man.
orange.
Yeah, you peel and then you observe the layers and then you peel the muscle. You observe
so now you're taught so that you can actually understand how
the anatomy. Yeah. So how can I treat you if I don't know what I'm doing? And I can only know that by playing with, or rather, doing it with a dead body.
Plus, I also need to see some reassurance when you're treating me.
Yeah.
Because I can imagine if a doctor is treating you and then they're like...
Yeah.
I don't want to hear
confidence.
that. Yeah. I really need to see your face you're telling me I got you. Just chill. I got you. Relax.
So how can you reach that point? Because you can't practice on, a living person, can you?
No,
you can't.
No, not really.
So you practice on dead bodies. We have people who donate dead bodies.
Oh yeah.
Rather than buying them or burning them, they donate it to science. So then you learn.
That's very interesting. And those are some of the things that don't come to play when maybe you're signing up for it, and then you're like, oh, I didn't think about this. This is a process that I actually need. This is the one bridge that I need to cross.
Yeah.
Okay, and then just what else would you say was just memorable from your college experience that actually made you say you know what, this is actually my calling and I actually want to do this? What's that one thing that
first of all, I really don't like seeing people in pain. That's not something I enjoy, or rather I don't think it's something anyone enjoys. So for me to be able to have that knowledge, to be able to relieve someone's pain or deliver a mom who's in labor, that's so satisfying. It gives me joy, if that makes sense. I'm happy when I see a kid coming crying that he's vomiting, then you do your magic, or rather you do your medicine, and then the kid all of a sudden after 3-4 days he's laughing.
It makes you actually feel good about what
it really does.
And gives your whole career a meaning.
It does. Or you see a mom in labor, she's in so much pain, she's almost dying. Okay. And then when you literally pull out the baby and give it to her, it's she's laughing. So where did the pain go? You know what I mean?
I don't know what you mean, but I'm just saying. I'm just saying it's. Plus, I'm guessing every single day and that's the thing. A lot of people get bored with their jobs because maybe it's a routine thing that you're doing and everything. But I'm guessing with a doctor, if it's something you actually like, every single day it's all these different problems that you're providing like a solution for.
That's true.
And that makes it like more interesting and
That's
keeps
true.
you intrigued every single day.
Yeah, it's true. It's true.
But
100%.
do you think just practicing it to some point makes you get numb to some things?
Yes.
Really?
Yes, 100%.
And look at her. When she's saying that, she has like a smile on her face. She's like, yes. Please explain.
Let me tell you. So,
yeah.
At first, when I was beginning off at Kenyatta last month,
yeah.
So currently I'm rotating at the obstetrics and gynecology ward. So delivering moms and CSs and all that stuff. So at first I was like, no, I'm not ready to see a lady in labor. That's not my thing. Like it's like I was feeling her pain.
Yeah.
Right?
She's screaming.
Yeah. So I was like it's like I used to empathize with her.
Yeah.
So, but the thing is, after you see like 3, 4, 5 moms delivering, you can't really feel bad for every single mom because that's not your job.
Yeah.
Your job is to literally get her out of that pain. You know what I mean? So at first it was really sad. I was like, no, you know what? Like I'm not gonna watch this because when some moms are delivering, like they actually tear, so I have to like stitch her up, and that's something else. So I was like, you know what? No.
Like tears, or what do you mean?
She tears up, like her where she's delivering from. She tears, like a tear.
Yeah. Okay.
You know?
No. I remember somebody giving me this discussion.
Or they cut her to like remove the child.
Oh my.
You know what I mean?
Yeah.
So then I was like, you know what? This might be me one day. Like I might be
so
on that bed giving birth.
I need to understand and be able to.
Yeah. So I used to feel her pain, but then I was told that you can't feel everyone's pain. That's not your job. If you feel everyone's pain, you're not going to be able to do your job. Yeah. So then I was like, you know what? You move on, you get used to it, and then after a while, it's like, you know what? It's fine. Mama Zatu.
So even when you get there and people are crying and then you just chill, you have
that's not your job. Can I go and cry with them? No. My job is to make them stop crying.
You just have that like face that assures them like you know
because if she's
it's
crying
just part of this.
and you're crying, who's doing the job?
You're making it even harder.
But if I'm
for
crying
her.
and I have like a doctor who's like confident with his job, like he's like, you know what, this is gonna end soon. Like I know what I'm doing. You're gonna feel some reassurance. You know what I mean?
Some reassurance.
Yeah.
Okay.
So you can't feel sorry for everyone.
True.
You do your job and you move on.
Okay, so at least now we know like just the whole process of how, we talked about how you can actually get numb to everything that's happening around you, people crying in pain and everything. Yeah. But let's talk about just the education system. Would you actually highly recommend, because it makes sense to me, would you recommend just people to actually go and study
in China?
In China? Or it's not something that you'd be...
It depends. Are you someone who's able to live away from home?
Yeah.
Are you someone who's financially capable of like sorting yourself out? Like you're given an allowance and that's supposed to fit you like the whole month or the whole 3 months, depending on the kind of... Yeah. So are you careless with money?
Yeah.
Are you... do you feel like you can live by yourself in a foreign land?
Yeah.
If yes, and you're able to like self-study, because China is a place where the teachers don't really speak fluent like they speak English, but like not really how it happens here in Kenya. You know what I mean? So you should be able to like get what they give you and then like self-study for yourself. Otherwise it's gonna fail and there's no point of going. So
especially in a foreign country, and here you are like actually not paying attention to. But was it easy for you? Would you say it was easy, or
nothing in life is easy though?
But are you like a self-sufficient person, because you're describing that?
Yes,
so I mean, to you can sit down, read a book proper, do a breakdown and everything.
But for me the thing is like the whole semester, like I'd be like in class learning and whatnot, but like when I hear like, oh guys, the exam timetable is out, you wouldn't see me. Like I'd be in my room or my house like studying, because I know the exams are coming. You know what I mean?
Yeah.
And you can literally have like a good time like the whole semester. Like you do, like you go to classes, you also go out. But once exams are close, you have to sit down and like study, because exams are everything.
They're everything.
Yeah.
Now, did your passion, because now we're talking about like I've said, like even in the podcast, I just like to talk about all these different things. First of all, you know what the podcast is all about, right?
Yes.
What is it about?
This podcast or your podcast?
This podcast.
Medicine.
No. Okay, not this in particular. Like just the
podcast.
Yeah, my podcast.
People, different people. 4
pillars of life: health, wealth, love, and happiness.
Okay.
And all different people like have just different journeys when you throw a question in any of those.
That's true.
So basically, we'll touch on all of
Everything.
them.
No
Yeah,
problem,
we'll
sure.
touch. So I mean, if you're not comfortable answering
No,
something,
it's fine.
Oh, you're good.
I hope so. Throw the question. Let me see what it's about.
Okay. No, we'll get to what.
Yes.
When we get to that bridge, we'll cross it.
Yes,
But
sure.
would you, just on your career path,
Yeah.
since you're already like almost at that point where you'd say, do you get like appointed? Like, at what point do you get appointed and to like, okay, now you're a doctor?
In Kenya?
Yeah.
Okay, in Kenya, basically, for someone like me who studied
Does
outside.
have you been appointed in China? Like, are you already like?
No, the thing is,
Or how does it? You see, like the way in law, if you're
Yeah.
doing like law in some different country and then you come to
the
Kenya.
bar exam.
Yeah,
It's the
a
same
bar
thing with
exam.
here, yeah.
You have to do it.
Yeah, I have to come back
Ah.
after my training and do like a license exam. Then and only then am I a full doctor in Kenya.
Okay, how's that? Is that an easy process? Have you done that?
No, not yet. I have to go back, graduate, and then come back and then do the exam.
Go back and graduate
Yes,
in
and then
China?
and then come back, do the board exam, and then I'm a doctor in Kenya.
How long does it take to?
To do the exam,
Yeah.
you do like a 4-month course where you rotate in the 4 major departments. That's surgery, internal medicine, gynecology, and pediatrics. So basically, you rotate in those 4 departments, and then you sit for an exam. But I don't think it's that bad. Like, I think it's
I
doable.
listen. Yeah.
I think it's
I
doable,
I
yeah.
agree. I'm not the one
Yeah.
who's doing it, but I agree.
I think it's 100%
Okay,
doable.
when
yeah.
it comes to that, to like just because now you're doing like a whole bunch of like everything you've just
Yes.
talked about.
Obstetrics and gynecology.
Yeah, man. What do you call the delivering of babies? What do you call
Obstetrics.
obstetrics?
Yes.
See, guys, you get to learn a lot
Yes,
of things
yes,
on my
you do.
podcast.
And then
Eh?
you have gynecology, which is like cancers of like the female reproductive
Oh,
system,
yeah.
like infections or basically anything not related to giving birth.
And you know, because that's also one thing. I'm guessing like how are people like, let's say in China, are they shy about like certain situations? Because I hear
no,
like
no, they're
they
not.
they come, like if somebody's sick they come, because like now from the Kenyan side I think people are more shy when, you know, it comes to like certain diseases.
Yes.
And they're like, you know, I'm just afraid of how the doctor is going to perceive this
Yes,
if I
that's
tell them
true.
like I'm actually
That's
having
true.
problems with my reproductive
Yeah,
system.
yeah.
Or
A lot of people actually, because people
and it
are
gets
not really,
worse even for you, right?
Yeah.
For them,
Yeah,
I mean.
yeah.
Mhm.
Because let me tell you, people are not really comfortable opening their legs to like a doctor and being like, okay, may I have problem A, B, C, D? Like I need like a checkup, you know?
I
People-
had
yeah.
one, and I've never gone for
Exactly.
like just what I experienced. I was
Yeah.
like, this is almost like abuse.
But that's the thing though, because as men, when you reach like a certain age, you have to go for like a prostate exam. And that's not comfortable, is it? Because they do things and you're just like, you know. no.
Okay, I'll ask you about something off camera.
Yeah,
then.
that's fine.
Because now we're friends.
Yeah.
Yo, I don't need to be shy about anything. And if you can guess what I'll ask her, I mean, I can,
Send you some money.
yeah, I can do like a giveaway or something.
Yeah.
So yeah,
Perfect.
Yeah.
Okay. So basically, me, let alone everyone else, I myself have never actually been to a gynecologist. And I'm saying that proudly because it's something that's true. Because so many people are not comfortable, including myself, going to a gynecologist. I don't think that, honestly.
Yeah,
honestly,
nobody
like,
is. Nobody.
no one
is.
wants to go to it. Like people have this mentality where it's like, but it's wrong. You have to go.
Yeah.
Because you have to get like a pap smear. Maybe you have like cancer, cervical cancer. You know what I mean?
Yeah.
Men, you have to go get maybe you have like prostate cancer that you don't know about.
Yeah.
But the thing is, for you to actually get there, you have to do a lot. Like you have to do things that are not necessarily comfortable. You know what I mean?
Yeah,
But this is your health that's at stake.
I'm just guessing. The funny thing is like when you're a kid and you're
Yeah.
being asked like, to go to hospital, you're always ready to like, like I'm feeling pain here.
Maybe
Here
go
like
to the hospital.
there's
because
a
of injections.
there's a certain age you get
Yeah.
and then you're like, oh shit. Like even just being told like take off your shirt. I'm like, man, this is my shirt.
Oh my God.
Now we
yes.
get to the pants. How psychologically, man, like I'm just like.
And then the worst thing is you go and then you find like a male gynecologist. Me, I can't do that. I'm sorry. Like
Like, no, that's not happening. I'd be like, and
then
they
he's
have
like-
a serious face and they're putting on their
Yeah.
glass. You're like,
Yeah,
this
and
is
I'm
not
like,
happening.
And I'm like, I'm sorry, like I have to like run, yeah? Sorry. You know what
So
I mean?
you ask for different, like,
yeah, for like a female gynecologist.
and even for me, I think it's always been like that. Every time like I just go and then it's like a lady, I'm like, oh shit.
Yeah.
Now when they start asking what the problem is, like,
Like you're not even comfortable
have
enough
to-
to give her all your symptoms.
yeah, it's crazy. But I mean, that's when now, like, even that's why for the podcast, I'm guessing I bring people like you to actually tell people that, you know what, as much as it might be uncomfortable, it is very necessary to go for checkups. You might avoid something that might escalate to a really big situation like in future. So why not take care of it in advance?
Yeah. But the thing is, okay, I feel like we come from a tradition where it's like you can't do ABCD.
Yeah.
Like someone can't stick their finger up your bumhole. I'm sorry, but like, but listen, that's how you do the exam. Listen, you have to.
Because this is a podcast, I'm just gonna come clean. That's happened to me before.
Exactly.
And
so people are not.
I told my friends, and until today they still haven't. Until today.
Can you imagine? So then people won't go for those exams.
But crazy thing is, like, I ask them, like, okay, I've done it once, so I'm always ready to go again. But you realize, like, for you guys, at some point you have to. They all said no. Yeah. They all said no.
So even if they do have problems, what happens? Like, he just stays with his problem. Like, he keeps it to himself.
Hey, you die. You die with your problem.
Yeah, exactly.
But that's wrong. But that's wrong. Now that's being selfish, because it's something that you can just,
So how do you get the Kenyan population to go for these checkups?
But that's what I'm talking about. That's where, like, you come in. Like, how does it come to play?
You have to value your health. That's the key. If you value your health,
that's okay. But put yourself in these people's shoes.
I am. I have never been to a gynecologist in my life. You know what I mean?
But is it because you're scared, or you just?
I don't think that.
Hey, come on. We need to find a solution. You can't say that even plus you're a doctor and you're saying no. Yeah,
but the thing is, okay, like, I have to preach I have to practice what I'm preaching. You know what I mean? If I myself don't feel comfortable enough to go to gynecologist, how do I tell people, guys, go see a gynecologist?
Yeah.
Like, it makes no sense.
But are you ready to process that mentally, and one day actually?
One day I will, yes, but not today. I will advise people to honestly go get these checkups done.
Get your checkups.
I'm advising myself as well. I'm in that bracket with you guys. Yeah. I feel like we should get checkups done, because these are very important cases, like cervical cancer. It's very, very, very common,
And, we've seen, like, even in social media, people having, like, certain conditions and complications, and that's when now they want to share, like, their journey and everything. And I'm just guessing, because I've heard, like, there's some people like experience something bad, even like during birth and stuff, and maybe they were in a hospital that didn't have, like, proper facilities and stuff, and they actually end up, like, like, just passing away because they were not even ready to just share or just come out and say, like, what, I think this went wrong. And it's just crazy. But I think what you're saying is something that a lot of people need to overcome. I don't know how they'll do it, but because even for me, I'm scared of going to the hospital. And even at times, like, I need to. Like,
there's no option, like, you have to go. That's the thing.
You have to. But that's the thing. You go there, you get treatment, and then you're like, oh my, it feels so much better. It feels so much better. So doctors are there to help you. And since we're speaking about this and just bits of health matters, what, like, let's say the situation in Kenya, like, what are some of the hospitals you think, like, and if you, like, have an emergency and you go there, you can get, like, medical assistance, like, ASAP. Because, like, even for me, that's one of the problems. I want to know about which hospitals I can just, like, dash to and have, like, I kind of, like, let's say, even if there is a lot of patients, I can get, like, proper treatment, even if, like, I'm not super rich or I don't have, like, a cover. What are some of the hospitals you think that would? Okay,
so first of all, I feel like it's always about your budget. If you had money, I'd be like, okay, go to, like, Nairobi Hospital, go to, like, Karen, or, like, these big, or, like, Aga Khan. If you have the money. If you don't have the money, or if you're not willing to spend, like, a few 100,000, I think Kenyatta is a good hospital for emergency.
100,000?
Well, these private hospitals are expensive, because if you're admitted, then you pay for bed, you pay for the doctor, you pay for you pay a lot of money. So if you have those finances, then go to private hospitals. If you need, like, care, like medical care, and you don't have that kind of money, go to Kenyatta. Kenyatta is really good, because the doctors in Kenyatta, they see a lot of cases. So they're, like, well experienced, like, their experience is, like, on their fingertips.
Are they motivated to treat you?
Yes, they are.
Sure?
They are, because they can't leave you dying on the street, can they now?
Not from what I've heard. But, wow. Okay, what about things like, because we're talking about finances, and budget, of course, definitely has to come to play. What about medical covers? Are there some that you'd recommend? Like, you know what? Because, you know,
like
I've been...
NHIF?
Yeah, not NHIF. Even that, like, a lot of people are saying now, I'm being told, like, it's actually helpful.
Yeah, it
but
is.
But I don't know. I mean, is it some...
Yeah.
Those, and even, like, you know, the AARs and the... What other insurance...
Isn't it like the ICEA Lion?
Yeah, those ones, like, what are some of, like, the options that, you know, you have and you can just recommend for people, like...
Okay, so...
And is it worth taking an insurance medical cover? Or you'll be wasting your time if you're those people, like, but me, I don't fall sick, like, I can stay a whole year without going to hospital and I'm paying all these premiums. Why?
Yeah, true. Okay, so... NHIF is really good because if you have NHIF, then I think I'm not sure, but you can also cover like your spouse. Does that make sense?
Yeah.
And it doesn't really cost as much as if you're going to like AAR or like ICA Lion. Like it's like a government insurance.
Yeah.
So and it covers a lot. Like it covers like if let's say like you have a wife who's pregnant and she's going under like the CS, like the cesarean section, it covers that as well. Like
and I hear that's super. How much is a...
In Kenyatta, I think it's almost 20-something thousand.
20 Gs.
Yeah, for the CS.
Okay, how about like a private hospital?
Oh, that's a lot. Like
how
a couple
much?
hundred, I think.
Yes.
Because then you pay for the stay.
Let's talk about price. How long do you think somebody would stay and how much would it cost? Because I want to know the number, because at times I hear people like who are like actually been asking for their friends to chip in to just cover the medical bill.
Yeah.
So some figures would be like, even a rough estimate would be nice just to have on top of my head, or people who are listening to the podcast, maybe they can know it would cost you roughly around.
Okay, so I've never actually worked at these like private hospitals, so I don't really know an exact price.
Yeah.
But I'm sure, or rather I'm approximately, that at Kenyatta the CS costs roughly 20-something thousand.
Okay.
Which I don't think is bad because...
That's okay.
Yeah,
that's okay.
It's like a whole surgery.
Yeah.
That's minus the stay though, because like you pay separate for the stay. But the stay isn't expensive because it's a public hospital. If you do go to the private ones, however, it's way more than that. But then again, the care is different.
Yeah. So it's like a tricky kind of...
And it depends on your budget. Do you have that kind of money to spend? On like a 3-day stay?
Would it be like, okay, would it 200,000,
yes,
100,000?
Roughly, yes.
200,000?
Yes.
Minus stay?
With stay, I think.
Okay. With stay? Would you, if you have like a medical cover, does that take care of...
I don't know if they take NHIF at private hospitals. At
no, not NHIF, but like in private.
Yeah.
If you have like, when you're getting like a medical cover and you've covered like, let's say your spouse, does it cover things like, you know, just in case she needs to deliver?
Yeah, like if you have like an insurance policy that covers both you and your spouse, then it should be able to cover her stay,
Okay, I guess I don't... Yes,
but the thing is, when you're like applying for the insurance, you have to like start like asking these questions like, do you cover my kids? Do you cover my wife? What do you cover? Because there's some insurance companies that only cover, let's say, like 2 ultrasounds a year, or some that have policies that say we cover like half price surgeries, or there are some who don't cover.
So even if you go through a procedure,
they only
like
pay half. Yeah, there are some who don't pay for elective surgeries. Elective surgery is a surgery that you plan for, rather than like an emergency where it's unplanned.
Oh, that the doctor actually saying like, you know.
You have an elective surgery where you're like, okay, I don't want to give birth naturally. I want to go through like the knife. Like I want to have surgery.
That means you've actually chosen.
So you're planning for the surgery. That's called elective surgery.
Oh, so now
insurance companies sometimes don't pay for elective surgeries because they're like, you chose this. We're not paying for this. They only pay for emergent surgeries where, let's say, you're giving birth naturally and something goes wrong and you have to like go for emergency right now. Then they pay for that.
Okay, that's kind of tricky, but you know.
So when you're getting insurance, make sure that you know what you're getting.
Just ask for the breakdown, and you know, at times when you get these guys coming or running through offices and stuff, they just show you these pamphlets, and then they're like, you know what, we cover this, and this. They're trying to sell. They're just trying to sell They're just trying, and they're trying to get, what do you call them? When you get that percentage after you make this sale, the commission. They're trying to get their commission, so they're just trying to sell.
So you be smart, know what you're getting, budget properly, and if you're under insurance, know what your insurance covers, because there's no point of going to hospital and to just end up fighting with your insurance company. Know what they're going to cover. Like sit down and be like, I'm paying this much money, what exactly am I getting in return? And view other insurance companies as well. Like don't stick to one because your friend said this is good. Like walk around, see what's good for you.
Do you know any that you've had like really good things?
I personally don't use insurance.
You don't use insurance?
No, at all.
Oh wow, you see?
Yeah, I'm not really covered by insurance. We just pay cash. Like, we don't really get sick that often, so I don't see why I personally should pay for insurance.
Oh, wow. This is coming from a doctor?
Yeah.
Okay, but would you recommend it? Because, like I told you, like, there's some of my friends who, like, when you're just having these discussions and then, these insurance people have been recommended, is it worth paying those amounts of money or maybe if, like, let's say you're alone, not really, but maybe if you have a family and like a kid, now that comes to play because, a kid is more
it's true. But the thing is, you have to first of all see your options, because when I was growing up, we didn't really go to hospital as much. Like, my mom used to like home treat us, like home remedies. Like, if you're vomiting, she'll give you like water and like lemon, or like if you have like a cold, she'll give you like turmeric and ginger. You know what I mean? So that if you're a person who believes that no, medicine is A1.
Self-medication?
Yeah. No, please don't self-medicate.
And I was about to, and that brings me to like the next question. Like, how people, do you want to finish that about how your mom was?
Yeah, sure. So basically, if you're a person who believes that if you have a cough, you're at hospital, then get insurance because you're frequently in hospital.
Yeah.
But if you're not a frequent goer, do you really think it's worth paying all that money every single month?
I don't know.
So it depends on self-preference. It depends on like your own personal preference. If you're someone who believes that, okay, I'm in hospital a lot, then get insurance.
Yeah.
If you're someone who doesn't go to hospital a lot, then I don't really see the point of.
Because you already know
that I don't go to hospital. I go like once a year, maybe, or I go like twice every 2 years.
What about like if you get into like an accident and stuff?
No, that's a risk you're gonna have to take.
Because I think, first of all, for me, that's why I think, like, let's say if you have a car, definitely get insurance.
Yes.
Because your car can't have insurance.
In Kenya, you're not allowed to drive a car that doesn't have insurance.
Yeah, but that's what I'm saying. Like, they've made it mandatory for, like, you to have, like, but there's some countries that it's mandatory to actually have, like, medical cover, I'm guessing.
That's true.
Because it doesn't make any sense. Like, why are you protecting your car more than you're protecting yourself?
But there's some companies that where you have to get NHIF, where they deduct money from your salary to fund NHIF.
Or for just in case, because they know in worst case scenario, at least these might actually come in and actually assist you.
So if you work for a company, ask them if they provide you with NHIF cover.
Okay, so my next question is on that self-medication thing. What do you think about that? Because like even nowadays, I think a lot of people just go to Google, check out their symptoms and treat themselves. Do you think that's where like the future is going?
No, I don't.
No?
And even if it is, then like it has to stop.
Maybe. Because I'm just guessing, like, where's the future? Because we have all these, like, social media things and everything. Maybe in the next 10 years, we'll have, like, a doctor who has, like, an Instagram account. They're going in live. And they're like, yo, tell me your symptoms. I'll tell you if you're sick or not.
But sometimes you actually have to physically see the patient and inspect them and, like, palpate and, like, touch and see what the problem is. Maybe the patient is, like, coughing and he has a mass. But you can't see the mass through Instagram Live.
What's a mass?
Like a growth, like cancer.
Oh, yeah.
Like if the patient has like a growth,
you have to be hands-on.
You have to be able to like palpate and see where the problem is. And you can't do that through Instagram Live, can you?
Nah.
You can't. Yeah. Actually, you can't.
That's a horrible...
But the problem is people run away from doctors.
That's a horrible idea, first of all.
Yeah, but the thing is people run away from doctors because they're pricey sometimes.
Yeah.
So they'd rather just take that money and go buy antibiotics from their chemist. And the problem with Kenya is almost everything's over the counter now. Like
you can buy anything you want. You can buy over the counter.
Antibiotics over the counter. Like that's insane because in other countries this is actually not allowed.
Yeah.
But in Kenya, no one cares. As long as they're making money, do I care? No, that's how people are thinking.
I've seen like even the way you can go to the chemist, and I've done it before. I buy like some painkillers. Maybe just see Google some stuff, and then go and ask for like painkillers and stuff, and then he looks at you and then he's like, I know, maybe if you try this would be better. Like they actually, no, they actually recommend like a doctor. They're like, I think you have Nini. So if you try this, and after like 3 days you can come back and like what?
Yeah.
So when you think about it, it's crazy because this person is not a doctor, but they're still.
But this is what's happening around Kenya, is it not?
Oh, it is.
Yeah.
Oh, yes, it is.
People would rather spend the 3,000 shillings that they're going to pay for consultation buying antibiotics for like 12.50 or even 1,500.
Yeah, people are not paying 3,000 for consultation. Like 3,000? Yeah. What?
And 3,000 is even like the lower limit. People pay up to 6,000 for consultation.
Yeah. But it makes a very huge difference.
It really does. Yeah. Because what if you have more than what you assume that you have?
Tricky.
Maybe it's just a cough. But what if you have like more than a cough? What happens then? What if you have like a whole infection? Then what do you do?
Horrible.
And you're taking like cough syrup. That's not helping you. And then and then the worst thing is your body's building tolerance. So the next time when you're coughing, this medicine might not even work for you anymore. You know
it's tricky. It's tricky. Yeah. It's tricky. Okay, now, what do you think at the end of it you'd want to do? What would you want to specialize in? Because you're doing all these different things now.
Yeah.
But what do you think, like, you're gonna settle for? Yeah. Kids.
I don't really know yet.
Or is there nothing yet? You still want to keep
I'm
testing
actually
out?
liking obstetrics and gynecology.
Really?
Because that's what like I'm beginning with now.
Yeah.
And it's very interesting because
plus it's the one thing that you're scared of as well.
And I feel like
so you need to understand it more.
Exactly. And I feel like as a woman, I'd want a woman to check me. If that makes sense.
Yeah.
Like I'm not comfortable with a man gynecologist.
Yeah.
Like, do you, boo? But you're not going to treat me. I'm sorry. You know what I mean?
Just think about it this way: you've walked into this institution, medical camp or whatever, and you really want treatment or checkup.
And there's only a man.
Then
I don't have a choice, do I? I have to see the man.
Yeah, it's either that or you. Would you do it? Or you'd be like, you know what? I'd rather go home.
No. Honestly, first of all, like I try my best to not do that. But
worst case scenario,
then I have to.
Yeah.
Or let's say like you're giving birth and it's only a male doctor. You can't close your legs, can you? Because the baby's already coming out. You have to give birth, and the doctor on call is a man. What do you do?
Yeah.
You have to. Like there's no going around it.
Yeah,
but the thing is, if the field is crowded with female doctors, then the likelihood of getting a man is also very less because women are also coming up as gynecologists.
No, and I think that's so important because even like now we're seeing like the way you've said there are higher numbers like of just like women in general like getting into like these professions. So, and I think it's not just about that equality thing. It's like about so that even if a lady walks in, like you're like a lady as well, and I'll make sure you're comfortable enough
because I know what you're going through.
Yeah.
So if you were to have the prostate exam, would you rather a female or a male doctor?
What? Oh no, that's tricky.
Yeah,
that's actually very tricky.
Would you rather have a man or would you rather have a female do it?
I'll just tell you, I'll be honest, the checkup that I got, it was a guy who did it.
Was it good?
What do you mean, was it good? What are you asking? What are you asking?
No, like were you comfortable? Like, did you make you feel like you're comfortable?
Very uncomfortable.
So you'd rather have a woman do it?
And that's the thing, like, because now if I'm thinking about it, there's no right answer to that.
There's no wrong answer, yeah.
No, it's crazy because, oh man.
So who would you rather do the test for you?
I don't know, because from a lady's perspective, I'm like, yo, this would be embarrassing, man.
Yeah. Because a man, you'd be like,
the worst part about a guy, like, here's the thing. Let me just describe to you what happens. Like, you'd be there. This person would put gloves, whether they're male or female.
Yeah.
You actually have to bend over.
Yes, you do.
We make fun of all these things, and then you're like, oh, shit.
And then he sticks his hand.
Please. Bad memories.
Oh, my God.
So, but this comes back to how do you talk to like shy patients? How do you let them, how do you ease in, because it's all like now even psychological, like you have to make them feel comfortable because you can't be just too professional and like.
The key first of all is listening. Like you have to make the patient feel like you're actually listening to the problems.
You're concerned.
And then before you do whatever it is that you're doing, you have to be able to make the patient feel comfortable in that specific environment. Yeah.
Okay. Interesting.
Yeah. Like you can't just be like, okay, I'm sorry, like move your pants and you're doing your thing. Like, you have to sit down and be like, okay, what do you want? What can I do to make this experience more comfortable for you?
Okay, we've touched a lot on like just, this medicine, just your path, your journey and everything. Now for the 4 pillars, like I've described, it's about like balancing like just everything that you have going on. You have like, I know you have like a different cultural background and everything, and just from what like even just the conversation we had before, like is it different like when you're working with like a hijab like right now in Kenya to actually like treat someone? Is it kind of different, or are you already used to it, like yo, I got you, I'm the doctor now, like let me just.
The thing is, seeing as I studied in China where people are very biased sometimes, you kind of get used to it. And in Kenya you don't really have as much as China, because these people know you, like, you're Muslim, you're Somali, you're ABCD, like they already know who you are. So there's really not as much bias, and whatever it is I push it away because I'm already used to that. Like I studied in China.
You've done it for way too long for you to
like you can't do worse than what happened in China. So whatever happens, it's like, it's whatever.
It's all good.
Yeah.
Do you know the next question is?
No, go ahead. Ask
Are you dating?
No, I'm not.
You're not?
No.
Are you trying to?
No, I'm not. I'm trying to be honest.
No, I'm not. No, I'm not.
I'm trying to be honest.
But do you think you need that? Do you think you need like a partner
Eventually, yeah.
But not for now?
No, not for now, no. Eventually, yes, but now, no.
Yeah. And when, let's say when it gets to that point, right? When you feel like, okay, yeah, I really do need like, because nobody's planning to die alone in this world. Of course. Yeah, to like just at least populate and have like companionship and everything. Would you rather at that time date somebody who's in like your line of work because they would understand what you're going through, or someone who's artsy? Because here's the thing as well. One thing is that we know you have a passion for both. Like you actually have a passion for photography, and that's what she mainly like highlights on her Instagram. So you wouldn't even know like she's a doctor. Yeah, true. I was like, true. Okay, so where would you really?
First of all, I'm already in my line of work, so I want I want to learn something different. So if I was to choose, I would choose someone who's not in my line of work, because like I'm already doing medicine all day, and then I come home to discuss medicine. Like no, you know what I mean? Like,
come up with some new.
Yeah, like work is work and home should be home. So if we work in two different fields, then we're able to come home and like discuss different things. Like medicine. Maybe you're a businessman or whatever it is that you are. Like
just something different that would.
Then you can come home and like I can learn something different about like a whole different career path or like a whole different field. You know? But imagine being a doctor from 8 to 8 and then come home to just speak medicine. Like, no.
Like, yo, I had this patient today, yo. You know, he has this and this.
Like
you feel like you're still at work, right?
Like at some point it's good because then you have someone who like understands where you're coming from. But at the same time, it's like we're doing the same thing. Yeah. So it's like.
And then also, okay, but here's another thing as well. Like, if let's say you're dating someone, does that mean like they get like, you know, free medical checkups and, you know, you'd always be like, yo, you're having a cough? I know what you should have. Like, you seem like you're a bit hot. I mean, would you be like that kind of person? Sure. Like maybe extra caring, like you're like.
I'll charge you a few times, but then
like
maybe
these symptoms that I'm seeing right now, I think you have
ABCD.
Yeah.
Maybe, it would.
Those are some of the benefits that come with it, I'm guessing.
The same thing I'm expecting, that if you're a lawyer and you get into some trouble, that you'd, advise me for free.
Yeah. Okay, for sure. That actually, it's like that makes sense now. That makes sense.
Like let's trade and like,
Okay, very interesting. When, like let's just say like in relationships, because now you're talking about like how medicine you'd actually have to do it for how many years? Is it 15 or 20 years?
Oh, wow. So basically you do undergrad for 6 years.
6 years ahead.
Yeah, and then you specialize for another 4 years, so 10.
Okay,
that's 10. Minus like internships and whatnot.
Minus internships? Yeah. Okay, let's include some internships and
11, maybe a year for like exams on 12.
12 years. Yeah. Okay, 12 years of study. So I'm just trying to put all these things into consideration with this question. Just as a lady, do you look at it as like, by the time I'm finished like studying, my biological clock, all those things, do they come to play? Do you think about them?
Yeah, actually, at some point, you do. Yeah. You're like, wait, like you either put like your career first, or you put like, you may want to have like kids early, or you put that first. The people who do both, the people who I know who have kids and are still in medical school, or people who have kids and like they're doing like their postgrads, like it works. People do, like people are able to like balance the two.
Has that thought run across your mind?
At this point, no. At some point, I'm like, wait, like what am I going to put first? But I feel like I'll cross that bridge when I'm at that bridge.
When you get there.
Yeah. Then I'll like jump over it or something.
Interesting. So now, since we've just mentioned a bit of the photography thing, where did this passion come in? Because that's like another hobby. I'm guessing like that's like your
side thing,
or just like how you like diffuse and just like reboot from like medicine and everything. True,
so I've always liked taking pictures. Actually, it's been a thing of mine, but I really, really got into photography last year. And it's very interesting because you'd be able to like study all day and then like go out and take like some good pictures, and you're like, this is good, and then you edit them and you're like, like it like makes your mind reboot kind of, or like forget what's happening and then like start afresh. Basically, like it helps you like just it's like sort things out. Yeah.
Okay, I'll tell you something that I've just thought about.
Yeah.
Have you thought of, because I don't see anyone else doing it, have you thought of merging like just what you do for work and the photography thing as well?
Yes, actually, I've thought about it.
Thought about it?
Yeah, I have.
So it's something, it's on the works, or do you want to talk?
Maybe.
How would it be like if you mixed like
photography and medicine?
And medicine, would it be like just to document, or would it be to like give an artsy vibe to something completely different that people are not used to? Like, I mean, I don't know, but I think it would make sense.
It would, because as I said before, I recently launched like a medical relief fund.
Yeah.
That basically helps people who are unable to. Basically helping people who are unable to pay for their medical bills.
Yeah.
Because recently you've heard that hospitals are not releasing patients due to unpaid bills. Yeah.
Yo, I saw that. That thing looks crazy.
Did you hear that story?
I saw a video.
A lot around Kenya.
Video. Yeah.
Because you can't expect a doctor to treat a patient for free, because this is his work.
So you lock them up?
I'm not justifying what they're doing, what they did before, but you have to understand that these nurses and doctors also need money. And where's the money coming from if patients don't have the money?
Okay, so but here's the thing.
It's a governmental issue, don't you feel like?
Okay, here's the thing. When you come to get that, okay, how does it get to that point? Do you come and then get treatment, and then you're told this is how much we're charging you?
Okay, the thing is,
and they didn't show up with money, or
the thing is, sometimes procedures are emergent, like they're like emergencies. So like you have a patient who came in complaining of like abdominal pain, I'm assuming, right?
Yeah.
So then at first you pay money for like registration or something of the sort. Then you get like admitted, okay?
Yeah.
And then all of a sudden the patient like has an emergency and you have to go for surgery. You can't be like, okay, we're not gonna do surgery until you pay money. Like it makes no sense, right? Like you took an oath to basically treat people as a doctor, so you can't be like, oh, I'm sorry, like you're dying, I can't treat you because you haven't paid. So they rush the patient for surgery. Then afterwards the patient's like, I'm sorry, I have no money. So what do you do? And you've already done the surgery.
Okay, yeah.
You know
so this
I mean?
is like a government.
Yeah, so the government is supposed to stand in and help patients who can't help themselves. But clearly Kenya is not doing that. So what happens?
Yeah, that's tricky. I saw that video and I was like,
yeah.
That's
or you
scary.
feel like, or you find patients who, like now, they know that they're really, really sick, but they have no money to go to hospital, so they don't go at all. Like they'd rather just die at home.
Yeah.
So basically, the whole point of the relief fund is to help people in such situations. People who are either being detained in hospitals due to unpaid bills.
Yeah,
or
they can actually come in and.
Yeah, or people who can't go to pay, like can't go to hospital because they have no money. You know what I mean?
Makes sense.
Yeah.
Makes sense.
Yeah. So my aim was to use photography to maybe raise awareness.
And that makes sense.
Yeah, because this is actually happening a lot, like more than you'd actually imagine. Yeah.
Well, that makes sense. Yeah. I mean, okay, that actually just answers my question, like just perfectly the way I was expecting it to go. And okay, so there's one question that I normally just ask people in general, like before they leave. But before I ask that, in this just line of work, is it a career path that you'd recommend to young people? Or anybody who's thinking about it, like, like what's just mentally, like what are some of the hurdles, or what's like the main hurdle you think like, you really need to be aware of this if this is what you're getting into?
In terms of medicine,
Yeah.
First of all, there's nothing like, oh, me, I'm like you can't leave medicine. Once you're in medicine, you're in it for life. There's no like, oh, I'm a part-time doctor. No,
you're not going anywhere.
Yeah. If you're in medicine, you're in it for life. Yeah, so you should be ready for because like you'll find someone and it's like, oh, I have ABCD. What do you think I have? You can't be like, sorry, me, my shift is done by. You have to.
Yeah, okay. Yeah, I know my shift is up, but since we're ready, let me just extend it a bit and figure out.
Yeah, or you have like a relative who's ill and he wants advice. You know what I mean?
Yeah.
So you have to be ready for such things. People approaching you just being like, I have ABC, what do you think I have? Or you have to be ready to study a lot.
I've told you I'll ask you something off camera. I mean, I'm just waiting for the podcast to end. Okay, and then does it get weird, like let's say when you know someone and you actually have to treat them? Like, yo, this is my friend. Okay, what if your uncle comes in, you're supposed to do a checkup on them?
Then I'd do it.
What?
Yeah.
No, but I'm just saying, but for you, does it feel like...
If he, okay.
Like I'd be like, uncle,
it's always
listen,
about the patient, yeah?
Let me just give you somebody who you'd be better off if they're treating you.
First of all, I feel like it's always about the patient. If the patient is uncomfortable with being treated by a family member, then I can always substitute myself and get you like another doctor. If you're fine with me treating you, I'm fine too.
Because I'm just saying, like, I'm going for this checkup and I'm like, at least I've gathered guts to go get like private treatment and everything. And then I walk in like this, the person swings the chair like this, and it's my friend. I'll be like, oh shit. What?
If you're uncomfortable, tell them I'm sorry, but like...
this is not happening.
Yeah, I want like another doctor.
Okay. Yeah. Interesting. I think we've touched base on quite like a lot just on the podcast. And I can't thank you more than enough for just... Because I haven't had somebody from your field.
Yeah.
And it's really like just an eye-opener, because all these questions are coming from like a just curiosity standpoint of view. And that's what the podcast also is all about, like people to understand and just hear these conversations that we might have, like, you know, as boys or friends, or just like, you know, just people who are somewhere together in a work situation, but we don't really get to hear or know about all these things.
True.
So I appreciate that a lot.
Anytime.
So one last question before we just wrap up.
Sure.
Just in life in general, what's the one thing you think like right now you're in pursuit of, and like if you achieved it, your life would have like better meaning, better direction, or...
That's a really deep question.
Oh yeah.
The one thing I feel like is gratitude. Because sometimes we take what we have for granted.
Yes,
Does that make sense?
Yeah.
And you have to realize that there's always someone who's worse, who's like in a worse situation than you are. Like, the thing is, once you're in the medical field, you realize that people have real life issues, like real life problems. Like us, we're complaining that, oh, I don't have ABCD, or I don't have like the latest iPhone, but someone is dying in the hospital because they don't have money. Or someone is dying elsewhere because they also don't have money. Like, people have real life issues. So I'm at a point where I really do want to be able to be grateful for every single thing that I have, because it really is a gift. Yeah. Wow.
See, perfectly answered, and a very simple way. She didn't say she wants a Benz. She didn't say, like, okay, of course, we all would. Of course, those are not bad. But I'm just saying, you know, there is more to life than those things that will just
those
drive
materialistic
you.
Things.
Those are just material. They're just those things that will give you like a sense of like more direction and just purpose. And I guess that's it. I mean, where can people? Do you want people to find you? Online? Can people find you?
Yeah, on Instagram.
They can?
Yeah.
Can they slide on that DM?
You can try.
Yeah, guys, you hear that?
You can try.
You can actually try. Shoot your shot if you can try. But before we just finish up. So yeah, where can people find you on Instagram?
On Instagram, at IJAY_Ahmed, which is AHMED.
Yeah. But they can call you Ijaba.
Yes.
Is that short?
IJ.
Yeah, IJ.
Yeah.
Much easier, man, because I have all these different, and you know, my audience and just people I host is just from a very diverse, like all these communities, and every time, like, I'm always like, I don't want to sound like your name to sound funny when I'm trying to pronounce it. So IJ
is good.
IJ is easy for me. That's easier. That's much easier.
And you can also check out my the relief fund.
And there was wait. You know, I don't want this whole outro to be proper. Like, where people can find you, and what else do you have going on in you, where that people, if they want to get involved, and you know, just throw that plug.
So you can find my relief fund at on Instagram at TAO Relief, which is TAORELIEF. That's the together as one, the relief fund. So check out the relief fund page. It's new, so I'm still working on it. But
that's it.
Oh yeah, and my other page, which I already mentioned. That's IJAY_AHMED. And go ahead and check them out.
Is there a way people can get involved in that project, or
yes, you can.
Private for now?
I've left the email address on the bio. You can feel free and send me an email.
And definitely, I'll also include like all those things like she's talked about and her details and everything. So it's been real, guys. Another amazing episode of the Kisscapades podcast. You can find us on YouTube, Instagram, Facebook. All of them in the description below. I'll put the links, but it's the Kisscapades podcast. Thanks for tuning in. Till next time, IJ, it's been real. Thank you so much.
Peace.
Bye bye. See you guys. Have a good one.